Welcome back to Achieving Unlimited Health. In our previous episodes, Dr. Cima has walked us through the chemical side of the triune: nutrition, hormones, toxicity, and blood chemistry. But today, we begin exploring the physical side of the triune: the structure of the body, how injuries occur, and why pain and degeneration develop over time. So, Dr. Cima will help us understand how physical damage progresses and why ignoring it often leads to chronic problems. So, let's dive in. Hi, Dr. Cima. I'm so excited to see you, as
Oh,
always.
same here, Layla.
All right, awesome. So, this is a question I've actually wondered about a few times at this point, because I remember in the first episode, you mentioned originally wanting to be a vet. So, how did you go from wanting to be a veterinarian to a chiropractic physician, changing lemons into lemonade, if you will?
Yeah. Actually, what had happened, I'll go back, I'll digress. When I was 15, my father was an avid hunter, so we'd go hunting all the time, and we'd practice shooting clay pigeons uh, with a shotgun. And so one day he was helping me, get set up and explaining to me when a clay pigeon comes over your head, don't shoot it. As soon as you shoot, don't shoot it goes over your head. Don't do that. So did I listen? No. So I had a double barrel shotgun, and I was 16, 15 at the time. And I was maybe 120 pounds soaking wet. So he was throwing the clay birds and I was shooting them. And then he threw one over my head and I missed the first shot. And I turned around. I didn't turn around. I just arched my back and squeezed the trigger to get the second shot off. And that's when everything, kind of like fell apart. My back started to bother me. And then days later, I was like, and really kind of incapacitated. There were times I just couldn't get off the floor. Now, being 15, you have those issues, but then they would kind of go away, and I was able to go back and do the things that I want to do. But it progressively got worse. It wasn't getting any better. So, through high school, the rest of high school, and then college, you know, like you said before, I was a pre-vet major, and as the time went on, as I graduated from Cornell University, I was, waiting to apply to the vet schools, and at the time, I was at my girlfriend's house, and I'm laying on the floor in severe pain. I'm talking about the pain was so bad I couldn't get off the floor. If I had to go to the bathroom, I wouldn't even know how I was going to get there. If the house was on fire, I don't know how I was going to drag myself out. So it was really severe pain. I'm laying on the floor, and one of her father's friends comes walking over to me, big, rough Italian guy. And he goes, "What's wrong with you?" Just like that. And I go, "My back is killing me." He goes, "Don't worry, it's going to get worse as you get older." He steps over me and walks out the front door. And I was like, there was the first time that I realized, you know what? I'm 22, 23 now. My back over the last 7, 8 years has gotten really bad. And I don't want to what am I going to be like in my 30s or my 40s? I wasn't even thinking about 50s, 60s, or 70s. I was just going to say, it's getting worse and I don't know what to do. I went to a few different doctors. One doctor told me absolutely no surgery. He said at the time they thought I had what they call a congenital problem. It's called a spondylolisthesis, kind of born that way. So
Hmm.
it's like, okay, I'm born that way, but I know what triggered it. It was that trauma from the shotgun. So I said, okay, fine. And I just, took it easy as much as I could and rested. And then, it kept on coming back. And then one night I was with the art teacher and we were silk screening t-shirts. And as I was silk screening the t-shirts, my back started to kill me again. So we went over to her house and she was having dinner for a few people. She was saying to me, "You ever go to a chiropractor?" I said, "No, I didn't even know what a chiropractor was. I wasn't sure if it was a foot doctor, like a podiatrist, or a chiropractor,
Hmm.
or chiropodist." So I was like, "I don't know if I want to be a foot doctor." He said, "No, no, he deals with your spine." And she says, "My uncle's a chiropractor, and I know a few chiropractors." So the interesting thing was her brother was there. And he goes to me, he goes, "Yeah, lay on the floor. I'll show you what they do." And I didn't know anything. So I laid on the floor. He cracked my back, cracked my neck. I would never let him do it today. But at the time, I didn't know what he was doing. And I got up and I said, I feel somewhat better. So they said, you should go to chiropractic school. You have the medical, you know, background. So it's not going to be really, really tough. So I checked out all the different schools. There was one out in Chicago and there was one in New York City. And I picked the one in New York City and I applied to both, got accepted to both, but I just stayed in New York at the time. And
Mhm.
it was a total eye-opening experience. I mean, had I not gone that way, I don't know what would have happened to my back and my life and everything else like that. So it was like I said, an eye-opening experience, but it kind of put me in the right direction. I said, you know what? If they can help my back get better, I would just love to practice and do that. I could just help people with back problems. I don't know, do you ever suffer with a back problem, Layla?
Not severely. I'll get an occasional backache and
Something,
things
yeah,
like
no, it's you're laying on the floor and you're in rifling pain. You can't move. Every time you try to move, it just gets
that.
worse. And so, but then a few days later, it kind of starts to feel better and better. But you start to realize, like, I'm 22 and it's getting worse. When I'm 32, it's going to get even to a point where I won't be able to do anything. And I'm not sure about back surgery. I wasn't really interested in the back surgery, especially after one or two of the doctors told me no.
Hmm.
They didn't recommend it. So I said, okay, I mean, what do I do to, take care of this? And fortunately, like I said, I applied to chiropractic school, got accepted, and then I was on my way. And it was probably one of the greatest decisions besides marrying my wife that I ever made.
Aw, that's sweet. But it's
But
so
that was it.
interesting, how a bad experience and pain actually led you to where you are now and how it
Yeah.
changed the trajectory of your whole career.
No,
And now, and now I think, in your 70s, if I'm correct, and you're
right.
pain free and you work 5 days a week, you've changed your overall health really from that experience. And are your kids chiropractors as well?
Yes, two of them. Out of the four, two became chiropractic physicians, and they practice here with me in the office. My daughter specializes in pediatrics and obstetrics, and my son more with he deals with people in their 30s, 40s, 50s, and around his age too. He's a lot more into the sports aspect of it too, as well, which I love. So we have a nice, well-rounded practice. We can treat people before they're born until the day they die. So it's kind of like we have all the different, criteria for each one of them. So it was really great because, and I never realized how great it was going to be, obviously, way back when, but it was like just such a perfect thing to get your kids involved with it. And I never even asked them to become chiropractic
Wow.
physicians. They decided to do that on their own. When I was applying to chiropractic school, everybody who I spoke to that had been to a chiropractor had nothing but good words to say. The only people that didn't have good words to say were people who never went. They go,
Mhm.
oh, I would never go to a chiropractor. Why? They'll kill you. I said, you ever go? No. So I said, why would I even listen to you? That's hearsay what you're telling me. And in court of law, that doesn't amount to anything.
Mhm.
So it was like this overwhelming, like, yeah, I had neck pain, I had back pain, I had this, I had that, and chiropractic helped me. So it was like I said, an eye-opening experience, and that's what really wanted me to, get really involved with chiropractic. And in my last year of chiropractic school, I saw a quote from Thomas Edison about the doctor of the future. The doctor of the future will prescribe no medication, more just patients and care of the human frame, which is the chiropractic aspect, nutrition, the cause and prevention of disease. I said, that's what I want to do.
Mhm.
No books. There was no course. I mean, today they'll call it like functional medicine. But back then it was called holistic health. But when I talk about all the different things that we do to treat the whole body, because that's what we do. When you come in, we have work that we can do as far as cranial procedures, which is really phenomenal work. And nobody does it today. Very few people use cranial. Most doctors don't even know about it. And the few doctors that do, they say that they do it, but I don't think they really know what they're doing. And it's something, I mean, chiropractic works with only 15% of your nervous system by dealing with the spine. When you're dealing with the cranium, you're dealing with the other 75, 80% of the nervous system. When I was starting to learn that they're called visceral, somatovisceral reflex patterns. And it's basically, they teach you how to like work with the gallbladder, liver, the stomach, so you don't have to get organs removed. It's a lot better to try to heal the organ before it gets to a point where it's really bad. Then you have to go through surgery and the rest of that stuff.
Absolutely. And speaking about that, Dr. Seaman, when you talk about overall the triune of health, right? What role does the physical pillar play long term in health and function?
It's really really important because, and most people today don't even realize it. Again, it's, when I talk to people about health and wellness, they go, "Oh, I eat good." So I said, "Yeah, that's nice that you eat good, but that's not what health is all about. That's only one third of the triumph." So it's the chemical side, and then you have the physical side, which is the other third, and then the mental emotional side. But the physical side is really impacted by the effects of gravity, and people don't even think about it. Especially when you're a kid. I mean, you're running around, nothing bothers you unless you fall off the table and, crash into the floor. Then you realize, okay, gravity's pretty intense. I got these, fractured bones over here from, the effects of gravity. And so that was the one thing that people don't realize. And I see it because I deal with a lot of people in their 60s, 70s, 80s, even 50s. And a lot of their problems have been going on for years, sometimes decades. And it's because the effects of gravity. It has a lot to do with their occupation, the daily activities of living, the way they sleep, traumas that they faced in the past. These are all things that come back to bite them. And at the time when you have the injury, sometimes it may take months, sometimes even years to really manifest itself into the body into something really bad. Like for example, you see a lot of people today going for knee replacement, hip replacement. Back in the 80s, they didn't even do any of that stuff. Now it's like every other day I'm talking to a patient, oh, I had my knee replaced, I had my hip replaced. And those things didn't take place overnight because, you caught a draft because you left the bathroom window, open. It was because of years upon years upon years, decades of traumas and injuries, traumas and injury, traumas and injury to get to that point. And then you go to the doctor and he says, oh, you have no more, cartilage left. It's, it's bone on bone. And
Mm-hmm.
so you need to go for the surgery. But that's not necessarily true because if you reposition the whole joint itself, you have what they call chondrocytes in the joint that replenish the cartilage. But if you're wearing it out fast and you're replenishing it, you'll never get to the bottom of it. So then they're going to do a knee replacement, which is followed by another knee replacement on the other side, which is followed by a hip replacement on one side. So you're going through two or three surgeries. As you get older, it's more traumatical to you. And that's if they go good. And a lot of times they will, depending on the doctor, but then you're going to need another one and you're going to need another one. And sometimes if it's not good, then you're going to go. I was talking to a gentleman on the golf course one day. He said, we're talking about knee replacements. He goes, oh, I had three. I said, three? You have three, you have three legs? He goes, no, I had two left. I had one done. It didn't work out. I had to have it done again. And then I had to have the one on the right done too. So it was like, and this guy couldn't have been more than maybe 55, 60 at the time. And he's going to wear that stuff out way before he,
Mm-hmm.
if he does live for a long time, he's going to be having some difficulties in the future with that too as well. So it's kind of like, the effects of gravity are on you 24/7, and you don't realize it until, you trip and fall down. And then you'll start to see like all kinds of damage occurring from that. But that's usually what impacts most people from a physical perspective. Gravity is the number one. It's pretty intense on the body. It never lets up. You could be laying down, gravity's pushing you into the bed. You could be standing up, gravity's pushing you to the ground. You could be sitting in the chair, gravity's pushing you into the chair. So it's like eventually that big impact of the effects of gravity on the body does take its toll. And then once that happens, then you're, in some serious trouble unless you get some kind of treatment to help realign the body. People think that, you don't have to take care of your body. It's kind of funny because, there's a universal law out there and it basically says it's called entropy. And everything in the universe goes from maximum organization to maximum disorganization. That includes your health, that includes your marriage, that includes your business, or that includes, your profession. So it's kind of like you always have to take care of it. And it's like, patients come in and like, I'll treat them and they're starting to feel better. And I'll say, okay, we have to put you on some kind of a maintenance. Like, why? It's like, you always have the effects of gravity on your body. That's one of the reasons why.
Mm-hmm.
I said, you have to keep on taking care of it. You also have to take care of it from another perspective because you have to learn how to exercise your body, this machine. You have to learn the proper stretches to do, and each person requires different stretches, different training methods and stuff to help make everything stronger and balanced. Another thing that really happens in life that people just don't realize is that we have a left and right sides of our body.
Mhm.
So, and we're never using the left and right sides equal. We eat one way, we sleep one way, we get in the car one way. If you play golf, you don't hit the ball lefty and then righty and then lefty and then right. And almost any sport out there is just more of a unilateral situation. If you're right-handed, then you're going to play it this way. If you're left-handed, you play it that way. So
Mhm.
it's always throwing the body out of synchronization. So even sleeping, people, may sleep on one side for maybe the whole night, which
Yeah.
kind of contorts and twists the body out of alignment. So you have all these different things occurring with the effects of gravity. So as time goes on, it gets worse and it gets worse and it gets worse.
Absolutely. And I feel like it's like you said, sometimes you push these things off, right? You're not
Yeah.
always thinking about what's best for your body, especially when you're younger. But why is pain something that is often so delayed, a delayed signal, rather than an immediate response to a physical injury?
Yeah. Usually, most of the time when patients come in, I'll ask them, I'll say, when the pain started, what were you doing? And most of the time they'll say, I wasn't really doing anything. I was just kind of like got out of bed and all of a sudden my back started to go out. That's a chronic situation that's been going on for years and sometimes decades. And
Mhm.
the tissue gets traumatized. They call it connective tissue, or a lot of lay people call it soft tissue. But the connective tissue gets damaged, the ligaments, tendons, and muscles, and that pulls the joint out of alignment. Once it goes out of alignment, the body still tries to compensate. Body's like amazing. It's like if you had to, when I check somebody physically, I hit spots they don't even know are painful. And then I have to explain to them. I tell them, I say, you know what? If you every day, if you got up and you felt every pain in your body, you wouldn't get out of bed. But the body is already compensating to try to figure out how do I, get this pain to kind of, reduce to a certain degree so I can be functional. And people live like that for a while. They go, oh, I'm getting older. They go,
Mhm.
oh, I'm having some hip problems on my left side. And it's like, so what are you doing? Anything? Not really. It's like, I can live with it. If they can live with it, they'll live with it. But it gets to a point where they can't live with it, and that's when they start to go for the different surgeries and the injections and everything. And a lot of times, a lot of people try to correct these problems. They go, well, I take a muscle relaxant, I take a pain pill, or I take, an anti-inflammatory. It's like, that's nice, but that's not correcting the problem.
Mhm.
Problem is physical. You're not going to cure it with a chemical. That's going to be the way it's going to be, and that's what people do. Oh, I just had, a shot, and now I feel better. But it's temporary. It's not going to last long, and it's going to come back. And when it comes back, you're going to be even more traumatized because you thought you were fine. So you're out playing your tennis or your golf or your pickle, and all of a sudden it's kind of like it's coming back, Doc. You need the treatment, and then you need to do physical things yourself. I explain to people, it's like it's your body. Like I'll show you what to do, but you have to do it. And then when they start to realize like how important that is, and they make my best patients.
Mhm.
They're out there stretching. They're out there taking classes on exercise. They come in for treatment. They play their golf. They play, and they're in their 70s and 80s. It's not like they're like 50s and 60s. They're out there like playing golf 2, 3 times a week, and 2, 3 times a week they're playing racquetball or tennis. I had just a patient come in the other day. He has a bad problem with his neck, range of motion, but the guy's in his 70s. He plays golf 3 or 4 times a week. He plays tennis 3 or 4 times a week. He was almost, he was a collegiate tennis star way back when he was in high school, and he still plays. But he still takes care of himself. I'm going to start working with him with his neck. He's got a lot more range of motion now, and he starts to realize like, okay, we can get this to really get better and better. Because at this point, that's all you want to do. You want to be able to play your sport and just enjoy it and have fun and not be in pain.
Absolutely. No, that's great that they're taking care of themselves so that they can live freely and not
Yeah,
be so boggled down with if I play this round of golf, is it going to be worth it later? Am I going to be in so much pain?
yeah,
And being able to fix that problem and just live freely is great. Especially, I could only imagine, later on in life, right?
oh yeah,
Oh no, and also I know that many people really assume that the body will kind of just heal itself, right? You keep
yeah,
doing these things and It will be fine. It will work
Yeah,
itself out. I mean, I tell myself that now in, my 30s. I think most people kind of tell themselves that, right?
yeah.
But why is it not always really true, especially for physical injuries?
That the body always heals itself or it doesn't heal itself.
Yeah, many people assume that the body will just heal itself. So why is that really not true for physical
Well,
injuries?
actually, it does heal itself all the time. But the
Hmm.
problem is that when you have an injury, the body has to compensate for that injury, and it literally has an impact on other muscles, and those other muscles attached to other joints. So you're having a whole bunch, you're having a kind of like a domino effect. So even though the knee is the problem, it's affecting the ankle, it could be affecting the hip, it could be affecting the low back, and it could be affecting the hip on the other side. So it's a lot of these different things are from compensations that the body creates to try to prevent you from getting worse. And to some degree, it does. If it tries to maintain you in a pain-free status, that's what it'll attempt to do. But it can only do, what it can do. So a lot of the injuries that they have, you'll see that, they were there for a long time. They're chronic. They've been there for years or sometimes decades, but they weren't at the point where it was like really, really impacting their life, their golf or whatever. But then through the years, the injury gets chronic and the tissue, especially muscle tissue, becomes what they call fibrotic. And fibrotic tissue loses its elasticity. It basically is very achy and it gets very, very weak. So the more fibrotic material you have as far as muscle goes, then you have more and more problems. And that's when people realize, like, okay, you have to work on this. And you can't just do it temporarily. This is going to be a lifestyle change. It's got to be. And if you don't do it, you're just going to suffer with more and more pain as time goes on. By the way, when I graduated chiropractic school, they were just doing a lot of manipulation. They weren't doing a lot of the muscle work and a lot of the other things that I now know. And at that particular point, I mean, even though I was graduating chiropractic school, that was back, yeah, I was still having back pain, but it wasn't as bad. It was getting better. Learning the martial arts and learning how to stretch and got into bodybuilding and not in a way to like get into competitions, but bodybuilding is a lifestyle. And
Hmm.
so learning all of that was okay. This is how you take care of the physical body. This is how the patient does it. Because a lot of times patients will go, well, I do a lot of physical activity. Well, what do you do? I walk. That's nice, but that's not physical activity. And it's nice you can walk around the block or 5 miles or do 20,000 steps or whatever. It
Hmm.
doesn't matter. You got to get the whole body functional. You got to get the upper body and the lower body equal as far as strength and flexibility goes. And the typical thing is with everybody, there's no pain.
Hmm.
That's the best part. When you can walk around and be in no pain and just take care of everything by stretching and all the rest, then that's the way you want to live.
And even with, for example, repetitive daily stresses, I think that you've even said this, but why do repetitive daily stresses actually or often cause more damage than, for example, one single
One
triple?
blast, yeah. Oh, the one blast, once you get into an auto accident, that's the best thing because it's the easiest way to describe it. Once you get into an auto accident, it's like a heavy duty trauma immediately. And usually within a few days to a week or so, you're in a lot of pain. And so that comes on really fast. But a lot of times in the last of patients, like, when did it start? Well, it started about 4 years ago. And they said, well, what'd you do then? It was like, well, I don't even, it was really not much I was going to do because I thought it was going to go away.
Mhm.
It's like you said, everybody thinks it's going to go away. And then it doesn't. But then by that time, you say to yourself, I can live with this. But every day you live with it, you're throwing the body more out of synchronization. So these activities of daily living and even golf. It's like if you can go out and play golf and just be in pain and not be, I mean, you can still go out and play, they'll do that. They'll take some kind of a pain pill or they'll take anti-inflammatory or muscle relaxant just to get through the round. And I explained to him, I said, that's okay, but you're trying to fix the sink when the refrigerator is broken. It's not going to work. You have to go out there and take care of the issue right now and do it in a way that's going to basically work with you and get you out of pain so you don't have to take muscle relaxants, painkillers. Not that you shouldn't do it, but it's not something you should do chronically.
Mhm.
If you had a car accident, like 3 days before you had the car accident, that's when it started, so to speak. But then when you have these injuries that go on for months or years or even decades, that lingering stuff eventually becomes so chronic that it's a lot harder to get the person well, and then teach them exactly what they need to do to stay well.
Absolutely. And why do you think that even, for example, small misalignments in joints or the spine specifically change how force moves through the body?
Yeah, once you start, there was something that we called it was called structure versus function. In other words, what structure governs function. What that really means is that based on the structure of your joint, that's how the joint's going to function. You change that structure in that joint from traumatizing ligaments to tendons and muscles, then what's going to happen? You're going to start changing the function, and you won't even know it. You'll use different muscles to do certain things, and not even know that you're not supposed to even use those muscles. But your body adapts to it. So this way, you say, it's like, okay, I can do it this way, and the body just automatically does it. But eventually, those lead to even more traumas to the body because now it impacts other limbs and other joints within the limbs on that side, and it'll cause a whole bunch of physical reactions, especially with certain parts of the body. There's one part of the body is called the sacroiliac joint, and that's at the base of the spine. And the sacroiliac joint really is where the left sides and the right sides of the body become one, and that's where your greatest amount of stress is, kind of just like a marriage. When you become one, you always have some, difference of opinions and stuff. And then the same thing with your body, where it becomes one, then you start, utilizing, let's say, playing golf. So now you're trying to like get the left and right sides of the body equal, but you can't do that because you're hitting the ball one way. And so it further complicates things because now even when you swing, it dictates even how you're going to swing a golf club. And with it being at the sacroiliac joint, the foundation of the spine, it controls all kinds of issues. Like pelvic problems, for example, can affect your shoulder. People go, wow, how does that happen? Well, the pelvic girdle impacts the shoulder girdle, and the shoulder girdle will affect the neck. So a lot of times a patient will come in and the problem is with their low back, but they have a neck pain. So it's kind of like, the body is very specific in how it deals with different things. And that's
Mhm.
what took me a long time. I mean, like I said, I've been doing this for almost 5 decades. So you start to learn, you know, all these reflex patterns in the body. It's amazing because people will go to me, patients, how do you know that that's painful? How do you know? How do you find that spot so easy? It's like, after 5 decades, I better be able to find that spot pretty easy. But the body sets up these perfect reflex patterns that whether you're a male or a female, young or old, they're there. And as long as you know what the reflex patterns are, and as long as you know like what the body's attempting to tell you, and you start to work with it, and you get those reflex patterns to break, then the pain starts to go away. The beauty about this, and again, I know a lot of times doctors will say, "Well, there's no scientific evidence that chiropractic works," which is kind of a joke at this point. But it's like this is how I work. You come in, you have neck pain. I check you and I find all the different areas in your neck and your upper back and your shoulder or whatever it is that's causing the problem. And I tell you that that's the cause of the problem. And when I break those reflexes up, and you're going to know broke them up because the pain goes away when I'm working on you. Once those are broken up, the pain goes away. And I can show you anatomically, physiologically, neurologically exactly what's going on. That's science. It's a
Mhm.
lot better than here. Take this pill. I don't know if you're going to drop dead tomorrow. You're going to go bald or you're going to go blind. Okay, but it might help your back. It's like, okay, I think I'll deal with the my back problem a different way. But that's what I hear all the time. And
Mhm.
and people they'll take any kind of medication or drug when they get to that point.
Mhm. Just for that instant relief, just to feel better in that moment.
That's the and they're going to get some relief. But let's say when you're playing golf. I know this because I treated thousands of golfers. When you get their bodies aligned, they hit the ball so much better, so much further, so much more accurate. Because the most important is your body, not your clubs.
And why do you think that, the body compensates after injury? And how do those compensations create even new problems?
Well, they usually, okay, that's a very good question. A lot of times a patient will come in and they'll go, I get pain in my left low back. and then we'll treat their left low back. And then, like within about a week or 2 weeks, they'll go, you know what? No more pain there, but it's now on the right side. And what had happened was the injury originally was on the right side, but because there was so much pain and weakness, your body compensates by putting more weight on the left side, and then the left side becomes more of a problem. So then it's kind of snowballs. But the body's always trying to right itself. It's always trying to right itself. We do things to try to not allow that to happen, but the body is always trying to right itself. And people don't realize that. They'll say, my knee, it's a bum knee. I hate my knee and all the rest of the stuff. Don't hate your knee, hate you, but don't hate your knee because the body's just trying to compensate and figure out what's going on. So, and then, like I said, patients come in with all different reasons and all different, pains and stuff, but the body's always trying to compensate to make it better. Now, when it can't compensate, now the compensations eventually become injuries.
Exactly. And speaking about that, so how do injuries to muscles or ligaments and tendons really kind of set the stage for chronic physical problems over time?
Yeah, that's a good question because the connective tissue itself, the ligaments hold bones together. They're like rubber bands, okay? And then muscles attached by tendons to the joint or around the joint, should say. So when every time you cause some kind of trauma to ligaments or tendons or muscles, it just gets a little bit worse, a little bit worse, a little bit worse. And as time goes on, with the additional repetitive things that you do, you cause more and more problems with that particular joint. And that's the chronicity of it. And then the muscle fibers themselves become, like I said, fibrotic. And then the joint starts to go through some degeneration. And it lays down calcium in the form of cement to protect the joint. And again, patients, even doctors, they'll go, oh, your problem is you got arthritis in the joint. It's like, no, no, it's not that. That's not the problem. The problem was the damage to the joint, which now requires calcium that the body's laying down to protect and solidify that joint. So the arthritis itself is a protective mechanism as much as it is anything else. But they look at it as like, oh, that's what's causing your pain. Your pain was there before that.
Mm.
It's just that now this is the chronicity of the problem. Now, because the ligaments, tendons, and muscles, like we said before, can't function properly, the body's next line of defense is like, okay, let's calcify the joint and try to prevent a lot of motion in that joint. And hopefully that'll start to get everything better. But when that happens, now you have loss of range of motion. And once you have loss of range of motion, it gets worse and worse and worse. So it's kind of like, that's what builds up. So when you're 60 or 70, you go to your doctor and he x-rays your spine or he takes MRIs. And it's
Mhm.
like, we know that it's a chronic problem. It's just going to take longer, but it doesn't matter how much arthritis you have. You can always feel better and get better
Mhm.
with therapy and treatment. So,
And you said that degeneration doesn't happen overnight. So how does injury slowly turn into arthritis and disc disease?
it usually takes, I would say, at least a number of years, to really get the arthritis going really good, or the disc degeneration at the point of like either they've bulged out or they herniated or they call desiccated, where they just kind of never got a good blood supply, so they just start to crumble. And those are the things that you don't do anything at that point. It's like the body's like past the point of no return. It needs help. And even if you just do the surgery, you still have to go through physical therapy. And a lot of physical therapy that they do on you once you have surgical procedures, it's kind of Mickey Mouse. It's not even, it's like if you have a shoulder surgery on the right side, they won't do any exercise, anything to show you on the left side. They won't show you anything to do with your pelvis. They won't show you anything to do with, let's say, your cervical spine. Because the minute you go away from whatever the injury was or is, then they can't do any therapy on that, which is stupid because your whole body's connected,
Mhm.
and they don't understand that. So when people go for, let's say, when they have a surgery, I say, okay, get your 2 or 3 or 4 weeks of um, post-surgery exercise, some slight stretching and things like that. Once they're done with you within 4 to 5 or 6 weeks, then you can come back and we can start doing more constructive therapy that will basically help you improve and get stronger and more flexible and just
Mhm.
get the whole body balanced.
And speaking about the long term on things, right? Why do, for example, rest, medication, or injections actually often fail to fix the physical problems in the long term.
So I
Wow.
think we're over medicated. And you know, if you look at everything now, it's like now you understand why we have a drug problem, not just for medications, but fentanyl and stuff like that.
Mhm.
Why do people take it? I mean, they're trying to kill their pain, whether it's physical, mental, emotional, whatever it is. And so, it's not going over there and just taking out Venezuela. There's been drug problems, and I remember because I went through a whole bunch of, presidents by this point. We had war on drugs, war on this, war on that. They're not winning. And the reason why is because younger kids, if you really educate them and teach them about drugs and not teaching them when they're 15 or 20, teaching them when they're in kindergarten, grammar school,
Mhm.
that's when they should start learning about it. I remember my dad always telling me when I was like 8 years old, he goes to me, James, anybody want to give you a goofball, let me know. I said, Dad, what's a goofball? Makes you goofy. That's how he told me. I said, what do you mean it makes you? He said, it makes you goofy. I said, I don't want to be goofy. So he said, well, then don't take that stuff. And so at an early age, I was like, already like conditioned to like, no, you don't do that. And I
Mhm.
lived in a bad neighborhood, and the older guys, they didn't, they were taking like, they were into back then, cough syrup was a big thing
Mhm. Mhm.
because it would get them really super high. As little kids, we would go to the pharmacy and they would give us like $10 to go
Mhm.
buy this the cough syrup. And you go into the pharmacy and you say, my mom's sick. She sent me in with $5. And they would give it to us. We'd go outside and give it to the older guys. And they would start drinking it and they would be goofy. They'd be falling off cars. And these guys are pretty tough guys. And I'm like, look, I don't want to be like that, act like that and feel like that.
I like the goofball thing though. That
Always said that to me, and it was like, Dad, I didn't even know what it is. We didn't know what the hell. I mean, I didn't know what drugs were at the time, but he did.
but it is super common that people go to the doctor and
Yeah,
need pain management and get those, kind of pills and do become addicted. It's something that's like you said, super common. Like
yeah,
America overall is pretty much over medicated. So that's why it's so important to fix the problem versus just trying to cover it with a
yeah.
chemical
No,
taking.
because and it's not going to go. And you're always going to get pains. Right? Like
Mhm.
that's one thing I explain to people. I say, look. I don't care if you're 50, 60, 70, or 80, or 90, you're always going to, there's always a chance that you're going to develop pain from either a fall or an accident. You
Mhm.
look at people in their 60s and 70s, their balance is already off. So
Mhm.
having that problems with your balance, you get up at night and you fall down, you crack your head open, and now you got to go for brain surgery. And there
Mhm.
was one of my patients one time, he worked in the ER 12 to 8 in the morning. And I said, Doc, I said, is he really busy back then? He goes, oh, Doc, he's unbelievable. He goes, a lot of people come in with brain bleeds. I said, brain bleeds?
Wow.
He says, yeah, they run blood thinners. They get up, they stand up, they fall down, bang their head off the, corner of a wall. They have them in surgery
Mhm.
right away. And I said, you kidding me? I thought it was maybe car accidents or stuff like that. And you see
Right.
it today with a lot of the elderly population. If you watch, they can't even walk anymore.
Mhm.
And I'm talking about like in their 60s and 70s and 80s. They're shuffling their feet. They're falling forward. There's no posture. There's nothing there that kind of keeps them in balance. You want to be able to walk and do things that normal people do. I'm not saying you should be out there playing football. You should be able to go out there and, play golf, play different sports that you want to play, and participate in life. So that's the way it should be. Most people are coming in, either they're wearing a hearing aid that doesn't work,
Mhm.
and you still got to yell at them, or the they're not wearing a hearing aid, and you still have to yell at them because they can't hear
One way or another.
Yes, it's kind of like, okay, it's you want to be able to kind of take care of that way before it becomes a problem. That's one of the things that cranial work does really well with, because it works with a bone called the temporal bone, which has your hearing and balance mechanism. And that's usually what gets really jammed up. Patients who are in their 60s, 70s, even before that, 50s too as well. But these techniques that we utilize treat the whole body. Like we work with the extremities, we work with the cranium, we work with the organs, work with everything. And that's what I wanted to do. So when I was going through chiropractic school, I found a technique that basically did all that. I know Socrates said, the closest you can ever get to God is to bring health to one's fellow man. Pretty much paraphrase, but that's the feeling you get when you take a patient that's been through the ringer with all different doctors and they are not being helped, and you help them. That you change their life, change your own life. So something that's really that's one of the reasons why I won't stop practicing. People go, "Oh, when are you going to retire?" It's like, why? I mean, I enjoy what I do, and to see the joy on patients' faces when you can try to help them with problems that they didn't have an answer for. That's the greatest feeling in the world.
Absolutely. Yeah, super rewarding, I would imagine, and just changing their everyday life.
Yeah,
And I never think about this, but yeah, you're way past at this point, standard retirement age, and you love what you do, and you're obviously really good at it.
yeah,
Even the way you said having, 5 decades of experience, you'll have so much more knowledge than a lot
yeah,
of people. And you really clearly understand how things in the body are fully connected, which
yeah,
even you talking about that, I had no idea. So that
yeah.
was, how certain parts of your body are connected. So it's just so interesting that to hear about that, and you have so much experience and you love what you do. So it's
The best part about it is that when you check the patient and you're going through all the reflex points and everything, and you start to explain to them, this is why you have a neck pain, TMJ, hearing. And then they start putting things together. They start to
awesome.
realize, well, yeah, he's right. It makes a heck of a lot of sense. It's like a show and tell when I'm working on them. So they really enjoy that and they really love it. And that's the part that like makes me really happy. See that kind of change takes place with the patient's overall health.
Absolutely. And speaking of, the physical side of the triune, how does physical dysfunction affect circulation and inflammation and the chemical side of the triune as well?
Or here's a perfect example. In your neck, there's blood supply to the front of the brain, and there's blood supply to the back of the brain. The carotid arteries feed the front of the brain, and when they run right in front of the cervical spine. And then the vertebral artery that goes through the vertebrates feeds the back half of the brain. When you have a distortion in the whole cranial area, you
Mhm.
put a lot of pressure on the carotid artery, a lot of pressure on the vertebral arteries, and impact blood flow to the brain. And since the brain requires, I mean, I think it's only what makes up 5% of your body weight, but it basically utilizes 25% of the circulation in the body. The same thing with oxygen and glucose. It's a small amount of weight for the body, but uses most of your glucose, most of your oxygen. So anybody that having neck pain, especially severe neck pain, it's affecting not only just the nerves, its circulation is being really impacted as well.
And how does physical instability influence nerve signaling or chronic pain patterns?
Oh yeah, well, what it does is it basically what happens is that you normally have a number of impulses leaving the joint. Let's just say it's 50 every 5 minutes. Okay, 50 impulses. As the impulses go up higher because of inflammation and pain in the joint, then you start to develop, let's say, more and more of a pain pattern and more problems with circulation. So it can go from 50 to 150, and that'll dictate like how much pain you have. It does really, it impacts circulation, and depending on what joint it is, it could impact a whole bunch of other joints. Like you affect the sacroiliac joint, Layla? I know we don't maybe necessarily know what it is, but it basically impacts every joint in the whole entire body.
Absolutely. Yeah, it's like I said, for someone who's not knowledgeable in that this field, it's so interesting to really think about how everything is really truly connected.
No, everything is. The body's intricately simple and simply intricate.
I think that this was definitely such a powerful look at how physical injuries really quietly evolve into chronic pain and degeneration when the structure of the body isn't restored. So, thank you again, Dr. Cima, for
You're
showing us
welcome.
that pain isn't really the problem. It's the signal that the physical pillar of health has been compromised.
Yeah, exactly. And
Absolutely. It's such an important conversation. And in our next episode of Achieving Unlimited Health, we're going to continue this conversation by further exploring how restoring physical stability allows the body to heal, adapt, and function as it was designed to with Dr. Sima's expertise. So thanks for this is a great episode, and I'm excited. continue this conversation the next episode of Achieving Unlimited Health.